MCG collectively, I think for a long while has thought about how do we make our guidelines more usable and accessible for all of our customers. And then as we've gone out and as we were talking to customers as we ordinarily do, we kept really hearing this piece about I feel that I'm using an EHR system. There's so many clicks I have to do to figure out what's going on with the patient. And then I have to keep this all in my mind as I'm then going and looking at the guidelines. Is there a way MCG can help bring all of those things together so that I can use the guidelines in a more effective way? And so hearing that, we really started to think, well, there are ways to do this. And as we went down this process, we realized some of the things that really jump out to people is like, how do we make sure that right decision is being made for that patient as they're in the emergency room? Because that's a big pain point for a lot of our customers, is really that one particular setting. We have been working really hard on seeing how do we take all the guideline content that we have and really embed it inside of workflows for physicians and clinicians. So this has turned into something that people know as Synapse. So Synapse is, think of it as like the brains of a computer system. What Synapse is really doing is it lets us take clinical data from electronic health record systems, bring it forward, and then let us use that data alongside care guidelines. We have so much great content. We have so much evidence-based, in-depth guidelines. We had to think about how do we take those guidelines and content and then make it so that a computer can understand it. And so we work with a team. We work with a team of physicians who are able to take this unstructured sorts of stuff and then really program it into a way of rules that then lives inside of Synapse, inside of the brains. It's this really massive interdisciplinary effort of, I think, almost everyone around the organization. So we get great input and feedback from the care team, so all the physician editors that are there. They provide us a lot of great insight on the rationale behind the guidelines. And then we work with some informaticists as part of my team who do some more of the nerdy rule writing stuff. And then the way that everyone sees this is really with the help of the C team. Our engineering team is able to take all of this stuff together, build all the actual machinery, the computer science and computer engineering behind it, bring it into something that a user can then see. So our first foray into this is Indicia for admission documentation. So this sits within our Indicia set of products. Indicia for admission documentation is really all about how do we get physicians who make admission decisions, how do we make sure they have the right information? At the same time, how do we make sure the patients are actually going to the right place once they're admitted?